and welcome to Askimo TV. I'm talking today to Dr. Alessio Agostinis. Dr. Agostinis is a highly specialist clinical psychologist based in the UK and is the principal and owner of CTT International, specializing in bespoke psychological consultations, therapy and training. Hi, Dr. Agostinis. How are you?
Hi, Joanne. I'm very good, thank you. How are you?
Wonderful. Very well, thank you. Dr. Agostinis, let's talk today about anxiety disorders and questions that people may have about them. What is an anxiety disorder?
An anxiety disorder is an umbrella term for a number of specific difficulties. Typically, people will experience a set of physical symptoms with anxiety disorders, such as palpitations, butterflies in the stomach. They may feel they'll be having a heart attack. They be ahead of themselves. The mind will be racing. They won't be able to keep still. They'll be restless. They'll have difficulties with sleep, and so on. Generally, we can say that such difficulties will have a significant impairment in their ability to function, to meet diagnostic criteria such as ability to work, ability to be in crowded places, ability to face certain situations, ability to socialize, and so on.
Dr. Agostinis, are there different types of anxiety disorders?
Yes, there are. There are a number of anxiety disorders. Obsessive compulsive disorder is one of those. Many people will have heard about those situations where people develop urges, ruminative behaviors, repetitive behaviors, anxiety with contamination, and so on. Post-traumatic stress disorder is also under anxiety disorders from a psychological point of view, although it's the only one for which the anxiety is related to something that happens in the past, as opposed to something that might happen in the future. Phobias come under anxiety disorders. We've all heard of phobias, spiders, snakes, and so on. Pigeons we get here in the UK from time to time. There's generalized anxiety disorder, where many situations, any situations, will really cause the symptoms we mentioned earlier. And it's difficult to have a specific target area. Everything basically causes anxiety. So people will be affected again for all of these quite significantly, occupationally, functionally, in their relationships, and so on. Shall I go on?
Are anxiety and stress the same thing?
But you see, I think the key point to make about this is that a lot of these disorders, anxiety disorders, depressive disorders, bipolar disorders, have a huge overlap with each other. Now, one of the reasons we have diagnostic classifications is that it makes it easier, if you're very skeptical about it, for drug companies and equally therapists to target their treatments to treat individuals. Now, that's good sometimes, it's not good other times, and I can give you some details about that if you wish, but it's a very lengthy debate. So you could argue that someone is stressed, experiences anxiety. At the same time, someone who's stressed for a long time may develop depression. It's almost like a burnout effect. So I guess the answer is yes and no, and it depends on the individual.
What are some of the treatments available for anxiety disorders?
Again, in the UK, for example, we got something called NICE, which stands for National Institute for Clinical Excellence, and there are a body of experts that review both scientific evidence and economic factors, and create a hybrid of those to make recommendations as to what works and what doesn't. Now, the treatment for anxiety and depression disorder is generally what we call a stepped care approach. So depending on the type, complexity, duration, previous interventions or not, one would access a certain intensity or dosage of therapeutic treatment. Now, at the very first step for anxiety disorders is self-help. People these days use the internet a lot. There are lots of self-help materials and textbooks. We know the evidence base suggests cognitive behavioral therapy, again, features quite heavily, and is a big mouthful, but all it stands for is a way of becoming aware of cognition, so thoughts and emotions, behavioral, so things we do or don't do in response to distress, and therapy is meant to alleviate that distress, not remove it, because part of this is our inbuilt safety mechanism. Now, the next step would be medication treatment or therapy. The next step would be both. The next step after that would be what we call a multidisciplinary care approach, which may involve physical therapists, medics, psychologists, all at the same time to try and tackle it from all different angles.
Dr. Agostinis, how common are anxiety disorders?
They are extremely common. The really interesting movement in therapy at this moment in time in therapies from a clinical psychology background, because we have to dip in all different types of therapy. We don't over-specialize in one. We're a bit of jack of all trades. And we have to keep in mind the evidence base. What we are beginning to realize that not only for anxiety disorders, but all mental health problems and sometimes some common musculoskeletal problems, also physical problems, what we at some time not so long ago felt was pathological, unusual, and a bit weird perhaps, we're becoming to realize that we are at a point where these things are quite normal. So anywhere between 14 and 20% of the population will be anxious. 2 out of 5 people at any one time will be clinically depressed. If we put in there rates of burnout, stress at work, divorces 50% plus, and so on, we soon come to a point where we realize some of these reactions are extremely normal. What, however, makes the difference, which is where therapy comes in, is how we respond and how we react to them.
Thank you, Dr. Agostinis. Thank you so much for talking to me today.
Thank you.